My name is Dimitri Daskalakis. I'm the Deputy Coordinator for the National Monkeypox Response at the White House, and I'm here to help you break down what you need to know about monkeypox. Monkeypox is a virus that can affect anybody, so it's important that everybody has awareness of the infection, but that we also arm people who are in the groups overrepresented by monkeypox with what they need to do to keep themselves safe. It can't tell the difference between people based on their sexuality or gender identity, so monkeypox can affect everyone. Now, what's important is also to be realistic. And when we look at monkeypox, the reality is that the majority of cases are currently seen among gay, bisexual, and other men who have sex with men. Infections do not heed geographic borders, and they do not heed, again, identity borders. So it's really important for everyone to have awareness about monkeypox, but also have the tools at hand necessary to prevent monkeypox, and that includes remembering to get vaccinated and making some changes in behavior while they wait for their immunity to kick in. There are three ways that people think about how monkeypox transmits. One is through close skin-to-skin contact, and that includes through sexual encounters. The other is through objects that have been touched by someone living with monkeypox. And then the last is through respiratory secretions through prolonged contact. So that doesn't mean a brief conversation, but things like kissing, like really long contact, prolonged interactions. What we see is a lot of individuals who are living with HIV have been diagnosed with this infection. It's really important to note that there's potential for increased severity of disease. Individuals with weaker immune systems, it's really important to try to avoid exposure to monkeypox. So really take those behavioral interventions really seriously, but also everyone living with HIV who is at risk for monkeypox should definitely get vaccinated. So there's lots of ways to protect yourself against monkeypox while you wait for vaccine, but let's start with get your vaccine. It's going to become more available, and so really important as a step to prevent monkeypox. So probably the most important is to consider reducing your number of partners and also avoiding anonymous or new partners, at least just for now while we wait for vaccine to increase. What about condoms? Well, condoms can confer some protection, but they're not enough by themselves. Remember, that skin-to-skin contact that happens during sex is how monkeypox transmits. So it's really figure out what makes sense for your sex life. Reduce your partners, avoid anonymous contacts, or do other things that can prevent direct skin-to-skin contact. There are lots of strategies. There's virtual sex, and there's ways that you can in person avoid that contact as well. And also have frank conversations about your partners about monkeypox and symptoms, because talking is a part of prevention. With that said, if you can't do that, it's all about harm reduction. It's about how can you minimize skin-to-skin contact. So really, the strategies are to try to really think about what your sex life is like, figure out what you're willing to or able to change to reduce your possibility of monkeypox exposure, and also with increasing supply of vaccine, get your vaccine. So currently, individuals who ought to get vaccinated are gay, bisexual, other men who have sex with men, and transgender or other gender diverse individuals who have had more than 2 sexual partners in the last 14 days, or who have sex in an environment or a venue where monkeypox potentially could transmit. So I think that those are the important populations. Oh, and also, if you're exposed to monkeypox, it's a slam dunk. Those individuals need to get vaccinated. But for folks who have theoretical risk because of what they've done in the last 2 weeks, those are individuals who need vaccine. And by the way, the current vaccine that's approved for monkeypox is a vaccine called Jynneos. That vaccine is a 2-vaccine regimen. Even if you've gotten your first dose and it's taking a little longer to get your second dose, that second dose is still really important, because a couple of weeks after that second dose, you have protection. There are also a couple of different ways to administer the vaccine. And right now, the most important one is something called intradermal, which is giving a vaccine in between the layers of the skin. So that does a couple things. It is effective, it creates an immune response that's really good, the same as the other dosing route, which is deeper in the skin. It's safe, and it also increases our supply of vaccine, so more vaccines can get in people's arms. The vaccine is safe and effective. It's a little bit of a mixed bag, so it's important to be honest that the intradermal dose, you may have more redness, you may have more itching, but actually you're gonna have less pain than the subcutaneous dose. So safe, effective based on the data that we have, and it's also important to remember that we're monitoring this vaccine very, very well. There's never been a monkeypox outbreak of this size in the United States, and so it's an opportunity for us to both get people protected, but also understand better how this works for the future. So more vaccine is available now. It's actually a really exciting time. Production has increased. We've actually started doing fill and finish, which means means getting vaccine in the bottle in the US, which means that it's going to also accelerate access. But then the other exciting part is that the FDA issued an emergency use authorization, and that really extends our ability to get more vaccine into people's arms and get them protected so they can get back to life. This monkeypox outbreak is unprecedented, and the truth is that we're learning about things as we go. We think that people who've gotten monkeypox are immune to monkeypox. We don't know for how long. So currently, there's no recommendation for people who've had monkeypox to get a vaccine after. Monkeypox testing is increasingly available. So the type of test that's available is something called a PCR, and it is a test that looks for the DNA of the virus. It specifically is a test that's done on lesions, whether those lesions are on your skin, in your mouth, in your rectum, or in your vagina. There's only one drug that's available currently for monkeypox treatment. It's called tecovirimat or TPOXX. And the best advice is to talk to your local or state health department or your medical provider to see where TPOXX is available. With that said, your state Department of Health or your local Department of Health can absolutely point you in the right direction. If your provider and your local health department don't know about how to get treatment for monkeypox, it's important to really bump it up a level. So if your local health department doesn't know, definitely talk to your state health department because they will have a clear sense of where monkeypox treatment is available. It's important to remember that the monkeypox treatment is still an investigational drug. So there's a little bit of a process to get it, but we've reduced the amount of paperwork and providers are actually giving us a lot of good feedback that actually it's coming quicker. Also, we're shipping the drug closer to where you live. So when someone decides that you need it, it won't take as long for you to get it. When I think about monkeypox, it's not just an abstract infection for me. Many of my friends have had monkeypox, and this is what I tell them. If you have monkeypox, it's really important to get tested and to talk to your clinician because they will help you figure out if you need treatment. They'll give you really good advice for how to prevent transmission of monkeypox, and also if you have pain, talk to them because they know what to do. For my friends who are worried about monkeypox, I say vaccinate, vaccinate, vaccinate. We have vaccine available, go get it. But in the meantime, make some changes in your life, just temporarily, so you can prevent exposure and then also potentially decrease monkeypox circulating in our community. We're in it together.